actually this is work done by my team on identification of tissue loading of cricket bowlers using thermal imaging technique as a predictor of overloading of the injuries. So basically it was we have some affiliations with sports and exercise. Exercise Mercy Unit, National Hospital, Kandy, Sri Lanka, at the National Olympic Committee and the Sri Lanka Cricket. So what is thermal imaging? So if you really concentrate the right upper picture, you can see the visible spectrum of the wavelength or the waves we are existing in our surroundings. You can see how tiny is the human eye has the capacity to detect this wavelength and make it into the visible spectrum. So this area is the infrared, so where you have to really concentrate and what we are going to capture as a thermal imaging. So everyone knows infrared is invisible to the human visible range, and what we do actually using this particular infrared into when it's turn out to be heat, so the visible images that depicts the spatial distribution of temperature differences in scenic wave by a thermal camera. So this camera is a high technological things, but it is been very highly used in the industrial world today, but not actually in other fields. But recently we have witnessed science and medicine also being highly applied using this particular technique, and it's a non-invasive as well as the remote sensing agent. So some of the applications of thermal imaging into medical field is the thermography. So we have sports as well as the normal or the ordinary medical practice, such as cancer detection therapy, especially to detect the efficacy of the cancer treatment as well as to identify some of the vascular disorders. In sports, there are some witness that thermal imaging is used to develop an optimal training program and distribution between the performance levels in athletes. Also, some of these sporting activities are being actually guided by the thermal imaging, especially based on their peripheral vascular circulation and the rate of sweating. So infrared uses in cricket is not a strange thing. As you know, there are some application of this being done to enhance the umpire's decision making accuracy. This is how to do it, and there are two cameras being placed on either corners of the ground, and the heat which is produced by the friction, the mechanism which is by the collision of the ball to their pads or their body parts can be detected, and it enhances the umpire's decision. So theoretically, cricket bowling is a repetitive action, so where you get loading on your tissues. So this tissue loading is actually influenced by various factors, which I just mentioned on a couple of them because we already know. And the end results of this loading is excessive blood supply and increase the body temperature of particular regions. So if it is happening continuously, and also abnormal loading is superimposed, what happens? The end results is you develop some inflammation of the affected tissue or the overused tissues. So the tissue fatigue, poor recovery and injury, or maybe the performance drop will be the results. Where this tissue loading technique is being used to capture this particular very small segment, that is the inflammation, where we don't have any technique or any technology at the moment to capture inflammatory tissues at that particular time at the moment. So the thought process of this particular study came up because there was no previous studies was done to detect the thermal imaging on fast bowlers, especially to identify their vulnerable tissues or assess already existing injuries. So obviously it's a low cost compared to many other investigations like MRI, ultrasound scanning, and many other things, CT scanning. And also you can do the real-time capturing of the images when you go into your training field or the ground field. Of course, you can identify the inflammatory tissues and the level of inflammation with certain degree of the information, but I would not say it is specific or very, very high sensitive as MRI or the other techniques. But as a simple tool, as well as the very usable tool, you can use it even to monitor the healing process by taking the serial images. And also, it can be a very important tool to identify the overuse and the overtraining status of the athletes. So this can actually apply to develop your prevention strategies which is not been applied before. Or one of the major concern is in fast bowlers is because of their premature ending of the career because of the injuries and also their overuse problems. So all those can be assisted, supported using this particular technique. So we have done our study in a prospective observation manner, and just only the junior squad 15 players was included. The inclusion criteria was the active players with informed consent, and the exclusion was players with existing injuries and conditions that affect in the thermal patterns of the normal human body. Of course, we use this FLY1 second generation the thermal image camera, and the camera was actually positioned in a fixed distance as well as a fixed angle to maintain the consistency of the image capture. So we can actually customize, you can actually use this camera, you can select the ranges, but we selected this particular range 20 to 120 Celsius degree range, and each image was taken after calibration of the camera to maintain the accuracy and the reading. So these are some of the regions actually we identified as an areas of the body where the infrared thermal capturing was taken and it was tabulated. And you can see none of these, the values not exceeded the normal human body temperature range. If it is go beyond 37.2, so it is not under the inflammatory conditions or normal thermal imaging, it's considered as a hypothermic condition. So image capturing was done before the warm-up as well as after the warm-up session. So you can see the first player example. The before and the after warm-up session was captured after the traditional, their team warm-up session. So second player also we did actually the thermal imaging after their team warm-up session. So what we realized what actually what our finding was, some of the players they do not reach their optimum thermal level or the warm-up level when they are engaging in their routine team warming up session. Of course, that is a good indicator that those particular individuals, when they exposed to another customized or maybe the next level or the second phase of warming up session, they will be, the images will be almost equal to the others. So that means actually each individual need their individual warming up sessions. Sometimes a team warming up sessions would not be applicable to the whole team. So that is a one indicator. And again, we don't know if you are, especially when the junior squads or the junior school cricket teams, even any other sports, usually they don't engage in individual warming up sessions by themselves. It's a group session. So we don't know who has, out of how many the players been, optimally warm up. So this is, you can use even to detect that particular information. So image capturing data after 6 overs of bowling was our main target of this study, and you can see some of these capturing was very well done. It was analyzed, and the 4 bowlers out of this 15 scored shows significant temperature patterns, and their trapezius, pectoralis muscles, and also the external oblique muscles of the trunk. The 2 spinners, you can see, show significant temperature patterns on their trapezius and the gastrocnemius. There's a lower body. So only one left arm orthodox bowler showed the significant temperature pattern in the right elbow and left tibial region. So 8 bowlers out of this 15, the group, and they didn't show any abnormal patterns. Yes, these are some of the additional pictures. You can see some trapezius region images, how it appear, and also the pectoralis region images, shoulder and the trunk, and also the gastrocnemius muscle area where you get. Actually, we performed the ultrasound imaging of this particular player. He has shown the Pedrick classification type 2 lesion of the medial gastrocnemius. But remember, because sometimes they engage irrespective of their injuries, because as you know, some of these players, pain threshold is so high. So they feel a little bit of discomfort, but irrespective of that, they engage their training. So sometimes they don't disclose their injuries to you, especially to the medical team. So they are, even with using this kind of a technique, you can easily pick up certain things and you can address their lesions without going into the worst scenarios. So in this discussion, this is a useful measurement for quantified training of the quantifying the training load in the athlete. So it can be used to identify the vulnerable regions in cricket bowlers that are at risk of overloading and injury. Of course, we know it's a non-invasive and non-radiating method, which can be used in children, because you know, if you perform serial images of X-rays, any other images which can be contraindicated or problematic for the school children, and it's not cost effective. And this can be used as an evidence-based practice to prevent overtraining in cricket bowlers. So there are some limitations. We cannot assess the deep structures and their reactions. Of course, could be influenced by some of the environmental factors, but you can minimize those things as you fix in a particular angle and also the standard distance where you are going to image from the player. So in conclusion, so thermal imaging can be used and to assess the adequacy of the warming up. And you can design, you can customize your player's warming up program. You know, everyone knows what are the benefits of doing a proper warm up by this time. So this is another technique which reveals the significant tissue loading patterns at the trunk and the lower limbs of the fast bowlers of the spinners. In this particular study, we saw what are the type of, because sometimes you might wonder like why this happens so superficially. Why cannot we, go and see the internal structures? Of course, this may be the initial process where their muscles been overloading. But when they continue, so in time to come, the internal structures can be affected. So where you cannot, but you need special imaging. But this can be used as an initial guide. And because this is a groundbreaking thought, we just thought of developing into this particular model into practice in sports medicine and sports science. So we need further research to study of the different loading patterns and different venues or different sections like training. We don't know how to do it during the matches, which is we can't take the players out and check it, all these things. And in time to come, if we want to develop some other ways, some distance capturing while they're in the field, whether we can detect it. and developing the image ability and the capacities of the cameras. So many things are been coming up, but anyway, we just thought of, you know, studying this, and this some of the images actually we captured were in other sports also kind of so informative. So anyway, it was a very good opportunity that we could apply into the cricket, and we hope to continue this research in a different scale and also to develop into a next level. So I think on my conclusion, I thank you everyone, and you can connect using these links with us if you really wanted to develop this technique in future. Thank you very much.